So hey guys, I'm back with another video, and this time I want to talk about depression again, but I want to talk about the diagnosis and treatment. Okay, so I'm excited to do this video because it's about treatment and I feel great about recovery, so I just want to talk about this. So the diagnosis of depression can actually be really easy. If you just go to your local doctor's GP, or I think in America you call it a physician or something like that, I'm really not too sure, but here in the UK we do call it a doctor or a GP, usually a general practitioner. And so you go in and you explain to them how you've been feeling, about your depressive symptoms, I guess. You explain to them how you've been coping with everyday life and work and school and stuff like that. Say if you've been attending class as regularly as you used to before this all happened, and if you've been going to work every day on time. Like, as much information as possible is best for your diagnosis or evaluation, is what they say. They might give you a questionnaire, they might not. If they do give you a questionnaire, it'll just be a few questions, probably about up to 10 questions, asking certain questions if your weight has fluctuated at all, change in appetite, if you've been feeling low, down, depressed for how long, stuff like that. And then they will basically mark it afterwards. They will give you an answer to whether yes, you have depression, or you have mild depression, or you're developing depression, or no, you don't have depression. So it's basically as simple as that. Also, if they don't give you a questionnaire, they could actually tell you themselves there and then if you have it or if you're just having symptoms. But mainly for the diagnostic criteria of depression, it's usually 2 weeks of feeling low, depressed, unhappy, uncontrollably, and you can't really get out of that. Sort of loss of interest in activities, no motivation to do things, maybe missed school or missed work, maybe not, but it has affected you on a regular daily basis. Sorry. Yeah, it's like your moods have affected things. So that's basically all it is really for a diagnosis. I mean, a lot of other mental illnesses do have very complex and complicated diagnoses, but depression is mainly quite easy to diagnose. So yeah. For the treatment, if you are at the doctor's when you get diagnosed, they may refer you to a treatment team or service that can give you some therapy for your depression, such as cognitive behavioural therapy or DBT. Also, there's tablets that you can take called antidepressants. There are lots and lots of different types, and your doctor will give you the right one to which your depression is, because a lot of the time with depression people might suffer from anxiety as well, so they'll give you antidepressants and anti-anxieties. Wow, that's a mouthful. But then again, you might not experience much anxiety, so they'll give you mainly antidepressants, and also depending on what dosage you need for the severity of your depression as well. So it's all to do with you, basically. So it's best to go to a doctor so that they can give you the right diagnosis and the right medication and treatment that you need. A lot of people don't actually go into the therapy side of it just because they don't want to talk about it, or they're not ready, or there's many different things why people don't go into therapy. But So a lot of people do just stick with the medication, and for those people who don't take the medication, like for example, some people can't take medication due to many things such as heart conditions, which could be unlucky for some people, but then again it is beneficial because it messes up the brain chemistry in your brain, in order for it to change, for your moods to change. So I guess if you do sort of try to recover on your own without the likes of medication, then that is definitely a plus, that your brain won't have to change all its chemistry and chemicals and all that stuff, just to help you with your moods. I don't really know what I'm trying to say, but with recovery, it's definitely got to be your choice. You have to do it for yourself. You can't do it for anyone else, because at the end of the day, it's you who has to do it and has to put the work in. And I'm not gonna lie, it's definitely probably one of the hardest things that anyone has to ever do, and that goes for any mental illness, not just depression, but it's a lifelong process. You have to keep putting the time in, putting the effort in, and it's hard work, but it's definitely worth it. And there's so many pros against the cons, which is great. I mean, I could do a whole entire video on the pros of recovery for depression, so I might actually do that as a recovery help. I don't know what I'm really trying to say. But yeah, I mean, there's loads of different treatment out there at the moment for depression, which is great. But yeah, I think another great thing is to talk to somebody or to write it down how you're actually feeling, because just letting it out from up here really does help, because it can feel like you're being suffocated by your thoughts and how you feel, and that the demons inside your head are actually taking over. But if you actually let it out or talk to somebody, write it down, it really does help to get those feelings outside of you, and it can make you feel such relief. So definitely please try that if you are in recovery or trying to recover or actually thinking about recovery, because that's probably one of the best things to do, is talking about it and opening up. So yeah, that's probably about it for the treatment side and the diagnosis, because it's so easy to diagnose and detect as well. I mean, a lot of mental illness is easy to detect, but some of them, you know, you can't, it's invisible, you can't quite see it. But this one is very visible, and it's very easy for a doctor to diagnose, and treatment is out there, it's available, and you've just got to find it, and you just got to go with it. Even if it's like the hardest thing in the world, you just have to try, because you know, if you try, then at least you've tried it. If you fail, a lot of people with depression think that they're a complete failure. Like, you know, if I try to recover and I fail, you know, if I relapse, then that is like the biggest thing, like I am just a failure. But it's so not true. Like, you're not a failure at all. Everybody slips up, everybody relapses, it's just a part of recovery, and yeah, I mean, you know, nobody's perfect, we're all human, so at the end of the day, it's just a part of the process. So thank you for watching this video, and if you have any questions, please feel free to comment or send me a message, and I will be uploading soon. Thank you, bye.